One common question that I get asked very often when I offer surgery to my patient is whether a particular procedure would be better if it is done robotically. That begs the question, is robotic surgery the standard of care for cancer surgery? Now, before answering this question, we should understand what robotic surgery is, what are its benefits, what are its limitations. So let me, before answering the question, just talk about these things. Now, robotic surgery is an extension of laparoscopic surgery. In laparoscopic surgery, the limitation is that we use rigid instruments. So sometimes while doing complex work, these rigid instruments are a handicap. We don't get the full flexibility of our hand. This limitation, to a great extent, is overcome by robotic surgery, where the instruments are flexible and all the movements which we can do with the hand can be done by the robot. The person performing the surgery is still the surgeon. The other thing is that you need not stand near the patient. You can sit at a console and do the surgery. The next point is that we get the additional magnification. The magnification which we get in robotic surgery is almost 10 times, that allows us to see blood vessels and nerves in a much more clear manner. The third point, which is the benefit of robotic surgery, is that everything is controlled by the surgeon. In laparoscopic surgery, the camera is usually held by the assistant, and sometimes the camera work may not be to the satisfaction of the surgeon. Unlike this, in robotic surgery, the camera is controlled by the surgeon himself. So these are the advantages of robotic surgery. The limitations, of course, is that it involves additional cost. It is not easily available, and sometimes some procedures may not be suitable for robotic procedure. Now, like any technology, this is a new technology, and when it is judiciously used, it offers advantages to the patient. And when it is not used so judiciously, it leads to unnecessary cost and sometimes may even do harm for the patient. Now, which are the procedures which are best suited for for robotic surgery? So, anything which involves a complex anatomy, because of its magnified view, robotic surgery tends to offer additional benefits over laparoscopic surgery. The other advantage is that the suturing, which is a little difficult laparoscopically, becomes very easy when it is done robotically. So certain anatomies, like deep in the pelvis, offer the robotic surgery offers a great advantage, especially if we talk about cancer of the prostate and radical prostatectomy. This operation definitely is superior robotically as compared to laparoscopically. Rectal cancers, which are situated very low down, again because of the complex anatomy, the preservation of nerves, robotic surgery has an advantage over laparoscopic surgery. Whereas in many other cases, robotic surgery may not offer that much advantage over laparoscopic surgery. Let me just give you an analogy. So like when you go to buy a TV, you may have different options, say a 4K option or a HD option. So now sometimes we have to pay, when we pay additional for the 4K option, we ask ourselves the question, does it offer a proportional additional benefit? And what if the transmission itself is not 4K? Then is there a benefit of buying a 4K TV? The same question comes in robotic surgery. Certain procedures are very suitable for robotic, whereas many procedures, the difference between laparoscopic and robotic may not be so much. So what should you do? Now, each case has to be individually discussed with the surgeon. If you have been offered robotic surgery, ask the surgeon what benefit he expects out of the robotic surgery as compared to if it is done laparoscopically. Of course, robotic cannot be compared with open surgery because there are limitations to open surgery, like a big cut, pain, and other things. But open surgery still has a role in certain very complicated situations, like we are going for reoperation, we don't understand the anatomy very well. So, open surgery too has its role. So, each case has to be individualized and discussed with the surgeon and see if robotic surgery is better than the other methods. Thank you.